that are cephalic to the origin of the sensory roots, and these sensory and motor roots anastomosis with each other before going to the Meckel's cave of the Meckel's ganglia. So in this picture, we see this is the cranial fifth ganglia that is located in the Meckel's cave. Here, this is the posterior root, and it joins here with the inside the Meckel's cave with the fifth trigeminal ganglia, and from here arises the three roots of the trigeminal nerve that goes to their respective foraminas. So this is about discussion of the superior complex or the upper vascular complex of the CP angle. So now here we see the relationship of the trigeminal nerve and with the superior cerebral artery. So this is the lateral portion of the CP angle. From here the dura is removed, and also the bone from the Meckel's cave and dura is removed as well to see. So here this is the mid part of the pons from which the cranial nerve fifth arises, and it goes here into the Meckel's cave where it joins the trigeminal ganglia, and from here the three divisions of the trigeminal nerve arises. And this part that this artery that goes superior to it is the superior cerebellar artery. So relation is that the superior cerebellar artery arises from the basilar artery, so it forms a loop. So first it goes downward, its origin is superior to the trigeminal nerve 5, but it goes down, forms a loop on the medial side of the trigeminal nerve and goes upward to join the superior cerebral peduncle. So every artery of the these complexes, that is the SCA, ICA, and PICA, when they arises, they goes in the CP angle, and from here they join their respective cerebral peduncle and then gives cortical branches to the respective cerebellar surface. So in this same manner, superior cerebral artery arises from the basilar artery, forms a loop here on the medial side of this trigeminal nerve and goes upward into the superior cerebral peduncle. So this is the point, this is the medial point where mostly the artery is compressed, and we have a picture of the trigeminal neuralgia. So this in the next picture we can see the clear loop. So here, so this is the trigeminal nerve. This is the straight retrosigmoid approach towards the trigeminal nerve. So this artery arises superiorly from the basilar and forms a loop and goes inferiorly, forms a loop. This is the lateral side, lateral surface of the trigeminal nerve. So it forms a loop and goes along the lateral surface of the pons to join the superior cerebral peduncle and goes to the tentorial surface of the cerebellum, because SCA supplies the tentorial surface, ICA supplies the petrosal surface, and PICA supplies the suboccipital surface, and each artery travels from the respective cerebral peduncles. So they all these arteries originate from their respective arteries, form a loop, and then join the cerebral peduncles of their complex and the cerebral surface. So here is the same. So this is the loop, and then it goes to the superior surface of the cerebellum. So here we can see that this artery is divided. This is the superior cerebral artery. It goes and it forms sometimes divided into two roots. These are the caudal and the rostral roots. And in these cases, the caudal root is the one that makes a loop near to the trigeminal nerves and causes the compression of the trigeminal nerves. G. So sometimes these arises early at their proximal origin. So the two trunks come down making a loop, but the inferior trunk is the one that compresses this nerve. Superior trunk goes far away from this trigeminal nerve, and most of the time the main trunk goes here, and then this artery is divided into the rostral and caudal trunk. This is the suprametal variant of the retrosigmoid approach. So if when we do standard retrosigmoid approach, we see the trigeminal nerve superiorly and the cranial nerve 7th and 8th inferiorly. The lower complexes are barely visible. So for this, we have to, if we want to go into the inferior complex, we have to go down more. We have to take more for inferior approach. So here we can see uh, the relation of the cranial nerve 5 with the superior petrosal vein that opens into the superior petrosal sinus. So this is the so because the anterior surface of CP angle is bounded by the posterior surface of the temporal bone. So this is the posterior surface of the temporal bone, and here posteriorly we have the brain stem, and from there the nerve and neurovascular complexes go either one or another direction. So this is the suprametal tubercle that forms the superior lateral portion of the internal acoustic meatus. So if we want to extend our rhotosigmoid approach more towards the posterior fossa, we have to drill this tubercle.
Intercanalicular जो सीधे angles होते हैं जो अपने canal के अंदर जा जाते हैं then drill that suprametal tubercle.
So this is the cranial nerve fifth. This is the suprametal tubercle, and cranial nerve here goes towards the middle fossa over the superior surface of the temporal bone. On the superior surface of the temporal bone, there is a depression on the medial side of this area. This is known as the Meckel's cave. So from here, the middle fossa course of the cranial nerve starts. So if some tumor is arising inside this upper complex and it goes beyond towards the middle fossa, and we want to get this portion via this single approach. So we have to drill this suprametal tubercle. Petrous part है, and this is the
for trigeminal stenomas, solivesical sternoma, trigeminal sternoma with that which is going from CP angle into middle fossas. So this is one of the ways कि आप middle fossa से आगे कर सकते हैं और यहाँ से भी कर सकते हैं.
So this is the safer area because if we comes from middle fossa via translabyrinthine approach, we have to sacrifice the hearing. So this one is the safe approach. From here we are far away from the semicircular canals and cochlea, and from this approach we can do both work. So here the relation of the trigeminal nerve is with two structures. If we see, this one is the superior petrosal vein. So here it is a cut section of the superior petrosal vein. So if you want to go for suprametal tubercle drilling, we have to cut or sacrifice this superior petrosal vein.
It is very common. It is very common that you rupture the superior petrosal vein if you retract the vein. तो हम सुपियान कर रहे होते हैं या ट्राइजेमिनल नोराल्जिया कर रहे होते हैं. अगर ट्राइजेमिनल नोराल्जिया करते हुए आपको नर्व नहीं मिल रही तो the first thing you find is superior petrosal vein. उसके नीचे हमसे ट्राइजेमिनल नर्व हो.
So yes, sir. So this is the superior petrosal vein that is cut here. This middle one is the cranial nerve 5, that is trigeminal nerve, and this artery that is medial to this cranial nerve is the SCA. This is not the SCA. Sometimes we say that this loop is of SCA if it is not labeled. So always the SCA is medial to the cranial nerve 5. So the loop is not visible from this side, from lateral view. So we have to retract the nerve to see the loop that is seen inferiorly here. That most commonly compress the nerve and causes trigeminal neuralgia. So here medially is the loop of the SCA. Here is the cranial nerve in the middle, and the superior petrosal vein is lateral to this complex. That is the lateral SCA.
जब आप ऊपर से देखें तो आपको superior cerebral artery जो है nerve के medial दिखेगी.
बिल्कुल. If we see from superior surface, I have a diagram as well.
So it's like a sandwich. Trigeminal nerve in between, petrosal vein ऊपर है, superior cerebral artery नीचे है. और जिस तरह ये कह रहा है कि superior cerebral artery के जो loops होते हैं कि शुरू होकर पहले अंदर जाती है. So this is the loop. So it arises from the basilar artery superiorly, make a loop inferiorly, and this loop is the culprit where most of the trigeminal neuralgia happens. But it's near to the origin of the trigeminal nerve from the pons, and it goes again superiorly over the superior cerebral peduncle and then into the
tentorial surface of the cerebellum via the cerebellomesencephalic fissure.
So आपने ये बताया कि आपने superior complex को CP angle में तो fifth nerve क्यों दिखा रहे हैं? Fourth और third nerve कहाँ पे है?
Fourth nerve भी सर वो बता दिए हैं, but because this is the major one and its relation are important, therefore I'm describing more, focusing more on.
CP angle में third nerve दिखती है?
बिल्कुल, yes sir.
Yes.
Third, fourth and if we see the so
आगे से कौन सी nerve चले जाए?
सर आगे से oculomotor जाती है.
वो तो नहीं दिखेगी.
Sir, this is the part of the complex, but if we see from retrosigmoid approach, this is difficult to see. Even the abductor nerve is difficult to see from this approach. But if we see anatomically, this is the part of the complex.
Anatomically, it's a part of that, but उसपे जब आप करते हैं तो you rarely see upper complex. चलो आप वापस आगे बात कर रहे हैं.
So in retrosigmoid approach, we have to identify the trochlear nerve before opening the arachnoid, because if once we open the arachnoid, this nerve totally was vanished because it's small thin fibers. So we just identify this fifth nerve.
So जब आप
practically
करते हैं brain, the most superficial nerve that you see is the 7-8 complex. Most people confuse the 7-8 complex with the trigeminal nerve. वो सबसे पहले दिख जाता है. देखो आप देखो सबसे ऊपर जो nerve दिखती है वो 7-8 complex.
So from retrosigmoid, this is the most superficial nerve, and this one is the. So, but we have to see the relation of the superior petrosal and the cranial nerve fifth, because it's lateral. So we can identify that the nerve would be more medial to it. So the nerve that is more superficial and lateral to it would be the cranial nerve 7 and 8 complex. So here again they are describing the supramedial variant of the retrosigmoid approach. This is the ICA that makes a superficial loop over the vestibulocochlear complex. Yes, sir. So if we see now the middle complex, it consists of the which nerves? It consists of the 3 nerves that are the 6, 7, and 8 nerves. So each complex has a complexes of 3 nerves, an artery, a cerebellar surface, a peduncle, and a fissure. So the nerve complexes are middle complex consists of the 6th, 7th, and 8th nerves. The artery is the ICA, and the cerebral peduncle is obviously the middle cerebral peduncle, and the surface that is petrosal surface, and the fissure is the cerebellopontine fissure, and the fissure related to the upper complex was cerebellomesencephalic fissure. So every artery that traverses the major artery, that is SCA, ICA, and PICA, every artery takes a loop or tortuous course. So as we seen the loop of the SCA that comes down on the medial side. So same here, there is a loop of the ICA as well. So it arises from the vertebral artery, and it comes down here and take a loop over the cranial nerves 7th and 8th, and from here it goes again to the middle cerebral peduncle. So from over the surfaces of the nerves towards the middle peduncle, it forms a loop that is detected here. This loop. So it arises inferiorly. SC arises superiorly and takes a downward loop. It arises inferiorly and take a upward loop. So here it's now seeing the origin. So it comes from the vertebral artery, goes superiorly, take a loop over the surfaces of these 2 nerves, and from here it goes towards the middle cerebral peduncle, then goes to the fissure, and then goes to the petrosal surface. So every artery has the same course. They goes to the peduncle, then into the fissure, and then into the surface of the cerebellum. So same here. So if you know the fissures and the surfaces, you can easily supply the can say where this artery supplies and goes. So this loop goes to the cerebral peduncle. From here it goes to the cerebropontine fissure, and then the supplies the petrosal surface of the cerebellum. So this is the loop that sir is saying that in sometimes we have a hemifacial spasm. So this loop of the ICA is most commonly the culprit. So pica can also compress this facial nerve from inferiorly, but 50% of the time this ICA loop is adherent and this causes the hemifacial spasm. Again, this is the cranial nerve 8, and these are relationship of the pica with the cranial nerve 8. And now, this is the superior view of the suprameatal tubercle. So this is the superior view from the CP angle. And this is the features part of the temporal bone, and this is the tubercle that is removed. Now we can see, if we remove the suprameatal tubercle, we can see the course of the vestibulocochlear nerves inside the internal acoustic meatus, because this is suprameatal tubercle, the posterior part of the internal acoustic meatus. If we go to posterior fossa, we also drilling this nerve as well, this tubercle as well. And this is the up now we can see this is the lateral surface. We are viewing from superiorly, but this one is the lateral area. This is the superior petrosal vein. This is the cranial nerve 5, and if we see cranial nerve 4 is more medial, and this is the, as sir has said, this is the SCA. So if we see superiorly, SCA is more medial to the cranial nerve 5. So these are the lateral to medial relations of the superior complex. सर वो आगे in the middle complex. जी सर. Yes sir, we have removed this tubercle. Labyrinthine artery होती है. This is also the branch of ICA that we will see in the middle complex. So this is again the superior complex and relation of the superior complex with the artery, then the vein. This one is the superior petrosal vein again, and here below is the cranial nerve 7th and the 8th. So this is the lateral view from which we are viewing this. Now here we can see the left retrosigmoid exposure for the middle complex, and the important nerve are the 7th and 8th nerve. So if we see laterally, this is the flocculus. Flocculus is the part of the cerebellum. Yes, sir. So, fetus is anteriorly. This one. This is not visible. We are seeing from the lateral direction. So, the lateral wall is removed. Cerebellum is retracted. We are supposing this, and this is the flocculus. So, flocculus is the part of the cerebellum, and it's obscured the origin of the 7th and 8th nerve. So if we want to see the origin, we have to retract this flocculus laterally. And the cranial nerve 7th is more anterior than towards the then cranial nerve 8th. So the origin of both the nerves are from the pons. But this facial nerve arises 2 mm anterior to this cranial nerve 8, that is vestibular cochlear complex. And these two nerves arises from the pons and goes into the internal acoustic meatus via the internal porus. And here the artery that is related to this is artery that is originating from below, comes here, making a pin-shaped loophole and goes here. So this is the ICA, the artery that is related to this. So ICA has 3 branches. The branch that runs with this complex inside the internal acoustic meatus is the labyrinthine artery, and there is another artery that arises from the mid portion of the loop, that is subarcuate artery. So here we can see this is the ICA, and this is the this one is the labyrinthine artery that travels with the this complex. So now here is here we can see the same middle complex, and there shows the relation of the choroid plexus with the middle and inferior complex. So this is the flocculus that is part of the middle complex, and this one is the vestibulocochlear complex. This is the ICA. And now if we see here, below the flocculus, there is the foramen of the Lashka, from where arises the choroid plexus. And choroid plexus lies over the lateral surfaces or over the dorsal surfaces of the glossopharyngeal and vagus nerve. So if we see the choroid plexus, and these are the nerves that are related to it, are the glossopharyngeal and the vagus nerves. And this choroid plexus is inferior to the 7th and 8th vestibular complex nerve. So the relation is here, that is, we can see below is the flocculus, and anterior to the flocculus is the choroid plexus, and in this fissure there is the foramen of the Lashka, from where this choroid plexus arises and lies on the posterior surfaces of the glossopharyngeal and this vagus nerves. So the relation is that the facial nerve is anterior to the vestibular nerve, and these lateral nerves, that is the 9th, 10th, and 11th nerves, are in line with the vestibular nerve. So these three nerves, that is the 8th, 9th, 10th, and 11th, lies in the same plane. Facial lies anterior 2 mm anterior to the vestibular nerve, and same hypoglossal nerve also lies anteriorly. So in this plane, hypoglossal nerve is not seen. Just we have 9th, 10th, and also the 11th nerve.
So glossopharyngeal nerve को identify करने का एक glossopharyngeal neuralgia होता है. So when people have glossopharyngeal neuralgia, it's a pain to identify the glossopharyngeal nerve. One of the ways to identify the choroid plexus and then look at the glossopharyngeal nerve.
As sir has said, when we see practically, these two nerves are very much close related. That is 9th and 10th nerve. That is glossopharyngeal vagus. We cannot separate these two nerves. So how we identify? So if we see laterally, if we trace these nerves laterally, because medially at the origin they are completely adhered to each other, there is very difficulty to separate the individual roots of these nerves. So if we see laterally, there is this lateral region, there is a dural flake or the dural septum. So it's the identification between these two nerves. So here is a dural septum that gives us some idea that these are two separate nerves, not a single nerve. So if we follow these nerves laterally, we have a dural septum that divides these two nerves. Sir,
talk about that first. That's important.
Yeah.
How do you differentiate between the
सर ये
तो यहाँ पे क्या ड्रम किया
जी सर मैं वो
इसकी तो तस्वीर नहीं वो लोग
ये वाला
तो ये basically how do you differentiate, because 7th and 8th is together and so आप facial nerve को identify करने का एक तरीका, अगर आपको ट्यूमर नहीं दिख रहा तो what you do is to drill the supramedullary tubercles.
Yes sir. So if I'm explaining each nerve. Trigeminal nerve goes to the Meckel's cave, okay, and 7th and 8th nerve goes into bony prominence, that is the internal acoustic meatus, and the complexes of the lower nerve, that is 9th, 10th, and 11th, goes into the jugular foramen. So here we are discussing about the course of these nerves from CP angle into the temporal bone. So this is the there are 4 nerves inside this internal acoustic meatus. These are the facial nerve and the superior and inferior vestibular nerve. So there are 2 divisions, that is superior and inferior vestibular nerve, there is cochlear nerve, and there is a facial nerve. So we have 4 nerves, and this yes sir. So this is the facial nerve. Facial nerve lies anteriorly, okay, and posterior to this lies the superior vestibular nerve. So this internal acoustic meatus is divided horizontally by a bony crest that is known as the transverse crest, okay, and the Bill's bar that is sir is talking about is the so first understand this transverse crest divides these compartments into 2, that is superior compartment and the inferior compartment. So the anterior part of the superior compartment consists of the facial nerve, posterior compartment consists of the superior vestibular nerve,
And again, if we see the inferior compartment, that is consists of two nerves. Anteriorly, there is a cochlear nerve, and posteriorly, there is the inferior vestibular nerve.
चार boxes बन रहे हैं, एक नीचे ट्रांसवर्स सेप्टम है जिसको ऊपर और नीचे में डिवाइड कर दिया, और फिर बिल्स बार है जिसने आगे पीछे में डिवाइड कर दिया, ऐसी.
जी सर. No sir, Bill's bar है आगे. So now the Bill's bar arises from this superior part of the bone, and it divides this complex, that is the superior complex, into two further, anterior and posterior portion. So this is the transverse crest, and this is from here the Bill's bar arises, and that divides the superior complex into two portions, that is anterior and posterior portion.
आगे जो फेशियल नर्व और आगे ऊपर फेशियल नर्व होगी, और नीचे अगर मैं कहूँ तो कॉक्लियर नर्व होगी, सॉरी
कॉक्लियर नर्व,
पीछे ऊपर जो है सुपीरियर वेस्टिबुलर नर्व और नीचे इंफीरियर वेस्टिबुलर नर्व होगी, ऐसे ही.
बिल्कुल सर. And this is the part of the suprametal tubercle. This is the area.
सॉरी, आप देखते कैसे हैं? आप देखते इस तरह हैं कि आप जो नर्व जा रही होती है इंटरनल मेटस पे, वहां से न्यूरॉन उठा के वहां पे ड्रिल करते हैं, मेटस खोलते, अंदर जाके फिर आप फेशियल नर्व को देखते हैं, वहां से फेशियल नर्व को फॉलो करते हुए बाहर आते हैं. And that's how you preserve the facial nerve. We don't do it, but a lot of people don't do it now. I mean, I'm just saying कि but you know, if you want to look, अगर आप facial nerve नहीं identify हो रही, so you can go drill your IC drill कर सकते हैं, drill और करा और फिर बाहर आ सकते हैं.
So sir is talking about the acoustic neuromas. So this is the approach towards the acoustic neuromas that goes into the internal acoustic meatus. So for this, sir is saying this, we will drill this posterior part of the internal acoustic meatus, and then identify, the principle is that we identify the normal nerves distally and proximally of the tumor. Tumor lies between, so we have a part of the nerve distally, part of nerve proximally. Proximal part is mostly couldn't be identified, so it's hard. So we identify the distal part of the nerve, and from here we see, we go and we trace the acoustic neuroma, because acoustic neuroma arises mostly from the vestibulocochlear nerve. So it pushes the facial nerve anteriorly.
अगर आप अपनी क्लासिफिकेशन देखें, लास्ट क्लासिफिकेशन इसमें एक है इंटरकैनालिकुलर है, इंटरकैनालिकुलर विद एक्स्ट्रा सामी.
So here we can see this is the bony vertical crest. Nerves are inside the, and this one is the vertical crest. That is the Wills bar. And this is the lateral view. This is the lateral view. And this is the inferior compartment. That is the cochlear area, inferior vestibular area. That is the transverse crest. Again, this is the facial nerve. This is the Wills bar. And this behind is the superior vestibular area. सर वो बता
तो आप ड्रिल नहीं, बहुत लोग ड्रिल नहीं करते इसको, बिकॉज हम लोग पहले ही ये ट्राइंग कि हम मैक्सिमम सेफ सेक्शन करें.
So here the flocculus is retracted laterally, and we can trace the origin of these two nerves, that is seventh and eighth nerves, from the brain stem. And this artery is the ICA. So now the this view shows the posterior wall of the internal acoustic meatus is removed. This is the dura, and after opening the dura, we can identify the superior complex, that is superior vestibular nerve and the facial nerve. And this canal is known as the jugular foramen. So we can appreciate here the relationship of the this internal acoustic meatus, this jugular foramen, and if we see superiorly here, this is the Meckel's cave. So this is the posterior surface of the petrous bone. There lies the internal acoustic meatus as well as the jugular foramen, and this superior surface that we can barely see here, the fifth nerve that goes superiorly. So here is the Meckel's cave. So
I'm sorry, I would want next time we would do that petrous bone in anatomy. Petrous bone, temporal bone in anatomy. It's very important, you know. Exam में टास्क बनता है, पोस्ट पूछते हैं, you know, आपको सेमी-सर्कुलर कैनाल्स का अंदाजा होना चाहिए, आपको टेम्पोरल बोन में, तो I'm just saying it's important कि हम यहाँ पे जाने से पहले ये टेम्पोरल बोन की एनाटॉमी करें, और खासकर फीटस पार्ट उसमें इम्पोर्टेंट होता है, सही?
So now in this picture we can see the relation of these nerve with the bone, that is the petrous bone. So trigeminal nerve goes superiorly, that goes seventh and goes into the internal acoustic meatus, and these inferior complexes goes into the jugular foramen. Yes. So here we can see that is the intracanicular part of the facial nerve, and this is the posterior part, that is the eighth nerve, this vestibulocochlear nerve. So here between these two nerves there is the rootlets or the fibers. These are known as the nervus intermedius. These are the part of this facial nerve. So these are in more proximate relation to the vestibulocochlear nerve and travels between these two parts, and laterally it joins the facial nerve in their course. So here we can identify this middle structure. So this is the nervus intermedius. These are the fibers of the facial nerve that lies between the main bundle of the facial nerve and the vestibulocochlear nerve. But we can see this is at the origin of the facial nerve. In lateral direction, it joins the main bundle. So again, here we see the superior vestibular nerve. These are the intermediate fibers, inferior vestibular nerve, and this one is the seventh nerve. So now this is the internal acoustic meatus that we have already studied in its parts. If we go more posteriorly or laterally, yes sir, बिल्कुल CP angle से we are seeing this CP angle, but we are looking at the posterior surface of the petrous bone, and this is more lateral. So here we can see that seventh and eighth nerves goes into the internal acoustic meatus, and this area is the suprameatal tubercle. Here is the Meckel's cave, okay, and this one is the jugular foramen, and inside this we can appreciate the jugular bulb. So if we go more laterally, so here is the orientation of the superior semicircular canal and common crus of the superior and posterior canal, posterior semicircular canal. So important is this, why it's important? Because when we are going to drill the suprameatal tubercle or the posterior margin of the internal acoustic meatus, we have to make a limit along this vertical line. So this is a vertical bony ridge. This is the limit. So we don't have to cross this limit, because if we go beyond drilling this, we can damage the superior canal and the crus of the both canals. So that's why here it is shown the relationship of the superior semicircular canal and the posterior canal with this internal acoustic meatus. So we can drill up to this vertical ridge, and superiorly we go up to the Meckel's cave. So these are the limits from which we cannot cross further. And below is also we have to see where the jugular bulb and endolymphatic ducts are. So this whole area is the lateral limit of the drilling of the suprameatal tubercle. So now we are seeing this CP angle from now the anterolateral view. So again, we can appreciate the origin of the trigeminal nerve from the middle of the pons. So this is the neural relationship. And here we can see that these nerves, these two are the facial nerve. Facial nerve lie more anteriorly than the vestibular nerve. Flocculus lies behind this, and inferiorly to both these structures lies the choroid plexus. And this choroid plexus lies behind the back of the glossopharyngeal and the vagus nerves. Okay, so these nerves, starting from the vestibulocochlear nerve, goes till the accessory nerve. They lie in the same plane. Facial nerve is 2 mm anterior to the vestibulocochlear nerve, and the glossopharyngeal nerves and the abduction nerve are lies more anteriorly or in the medial direction. So the glossopharyngeal nerve arises from the anterior part of the olive, and these nerves originate from the posterior part of the olive, that is the part of the medulla. And this abduction nerve arises from here, that is medullary sulcus, and it lies more medially. So this is the relationship of the nerves from anterolateral direction. And these two limbs that I have described, that defines the limit of the CP angle. So we have two limbs, superior limb and inferior limbs. So the area between these two limbs that is covered by the petrosal surface of the cerebellum is known as the CP angle. And here is the anterolateral relationship of this area. And नहीं सर So now the arterial relationship of the CP angle from the anterolateral direction. Now we this picture is overlapped with the arterial supply. So here we can see, as I have defined the middle complex, we see that ICA originates superiorly and then goes down, making it arises from the vertebral artery. So it arises from the vertebral artery. It has two loops, that is inferior loop and then the superior loop. So the inferior loop passes behind or below the abducens nerve. This one is the abducens nerve. So it comes from superiorly, take a one loop that is below the abducens nerve, and then again go ascending superiorly and make an other loop that is overlying the seventh and eighth nerve. This is the second loop, and this loop is one that is causing compression of these nerve roots. And from here, the ICA goes towards the middle cerebral peduncle. Middle cerebral peduncle is not seen here because it is, we can see from anterolateral direction, so it is cut down. So it goes to the middle cerebral peduncles and take a route into the fissure. That is the cerebellopontine fissure, and now it goes and supplies cortical branches to the petrosal surfaces. So this is the origin of this. And from here we can see this artery is the SCA, superior cerebral artery. Now this is the variation of the superior cerebral artery. This is the caudal trunk and this one is the rostral trunk. Most of time it has a main trunk that make a loop, and when it goes superiorly, it divided into two trunks. But in this picture, it is making proximal division. So we have two trunks, that is rostral and caudal trunk. And in this, the loop that is lies near to the trigeminal nerve is the of caudal trunk. So it makes a single loop. ICA makes two loops, one below the abducens nerve and one overlying the vestibular cochlear complex. And now we see the pica as well in this. So the relationship of pica is that it arises from the vertebral artery and also it makes a loop, but loop of pica is not as much sharp as the loop of these are two arteries. So it crosses the hypoglossal nerve rootlets and sometimes it goes between these rootlets. These are the rootlets of the hypoglossal nerve and goes between the below the glossopharyngeal and vagus nerve and then travel down into the cerebellomedullary fissure and into the suboccipital area. So if we see the further parts or segment that is beyond the CP angle, so are the four segment of the SCA. SCA has four segment beyond the CP angle. ICA also has the four segment and pica has the five segment. Okay, so these will be further defined. Yes, sir. Anterior medullary, lateral medullary, tonsillar, and tonsomedullary, and last one is the cortical segment. So this is the artery relationship of the CP angle with the nerves. That was the last venous relationship. So the veins related to this one, if we see superiorly, there is a major vein. This that we have defined earlier. That is the superior petrosal vein, and superior petrosal vein is formed by the vein of the middle cerebral peduncle and the cerebellopontine vein. These combines and form the superior petrosal vein along with the transverse pontine veins. So here we can see the transverse pontine vein Here is the in the middle is the vein of the middle cerebellar peduncle, and from behind there comes a pontomedullary vein. So these three veins combine to form a superior petrosal vein, and this superior petrosal vein superiorly joins the superior petrosal sinus. And inferiorly, there are multiple veins relating to the surfaces of the cerebellum. These are the major ones are the retroolivary vein. That this is the retroolivary vein, and this one is the vein of the pontomedullary sulcus. These two veins combines to form the vein of the middle cerebellar peduncle that ultimately drains into the superior petrosal vein. So again, this is the relationship of the nerves with the choroid plexus and the flocculus that I have already defined. And this is again the superior anterior view of all these nerves. These are the trigeminal nerves. Which nerve is this? Vestibulocochlear. And this one is this anterior nerve is the hypoglossal nerve. So now this is the same relationship of veins in the CP angle. So this is the last slide, and this is the posterior view of the retrosigmoid. If we see from retrosigmoid approaches little bit posteriorly, we have relationship of these nerves like this. So here we can see the fifth nerve that is originating from middle part of the pons. Here is the in between in the middle is the vestibulocochlear complex that goes into the internal acoustic meatus. This goes into the Meckel's curve, and inferiorly this we can see choroid plexus, and this is overlying the 9th and 10th nerve, and these goes into the jugular foramen. And this part of the cerebellum is the रिकॉर्ड हो
किसी को सवाल तो ये नजर टच करो किसी को कोई सवाल नेक्स्ट क्या कर रहे हो बोल बोल के नाटक कर सकते हैं आप भी करा सकते हैं ये मुश्किल
नहीं इधर हो जाएगी
आज सॉफ्ट में रिपीट दिस पार्ट ऑफ द बोल बोल के नाटक तो सवाल प्रेजेंट कम नहीं कर रहे काम कर लिया
Nervous system behaves or the facial nerves in मेरे
अलग से नहीं बना हुआ, कुदरत ने उसको अलग से बनाया हुआ है। तो हम इसको रेडी करते हैं।
नर्वस इंटरमीडिएट में कुछ
नर्वस इंटरमीडिएट ये होता है कि ear to vestibulocochlear nerve होता है। हमें लगता है कि this is the part of the vestibulocochlear complex, but it's the part of the facial nerve।